This video shows penetrating keratoplasty in congenital hereditary endothelial dystrophy in a 1-year-old infant. First of all, a limbal fixation Flaringa ring is applied to prevent sudden collapse of the globe. The ring is then sutured to the conjunctiva with 4 to 6 fixation sutures. The size of corneal button is measured with the help of a caliper. The donor button is then refined with the help of a 7 mm disposable refine. Side port is made to inject viscoelastic into the anterior chamber. This prevents trauma to the lens and iris during trephination. The recipient button is then refined with the help of a 6.5 mm disposable refine. The excision of the button is then carried out with the help of curved corneal scissors. Hyperventilation by anesthetist during this stage prevents spontaneous lens extrusion and reduces the chances of suprachoroidal hemorrhage. The pre-defined donor tissue is then placed over the viscoelastic bed and first cardinal suture is applied at 12 o'clock position. Second cardinal suture is applied opposite to the first cardinal suture at 6 o'clock. Similarly, third cardinal suture is applied at 3 o'clock position. The fourth cardinal suture is applied at 9 o'clock position. The rest of the sutures are applied in a similar fashion in between the cardinal sutures. It's important to apply only interrupted sutures as chances of loosening up sutures post-operative are very high in pediatric age group. Suture knots are then buried with the help of tying forceps. Viscoelastics are then washed from the anterior chamber through a side port with the help of Simcoe's cannula. The limbal fixation ring can now be removed. Side port is then hydrated. Side port should also be sutured in pediatric age group to prevent any postoperative leakage. Thank you for watching.